Well, welcome everyone. We are very pleased that you joined us today for our inaugural event of the Clare and Jerry Rotenberg Institute on Aging at Jewish Senior Life. I am Christine Van Vessem, the Vice President of Staff Development and Quality Management. I am now pleased to introduce you to our President and CEO, Mike King.
All right, thanks, Christine. Wow, it's great to see everybody. You know, I've seen many of you on Zoom calls, a lot of you just still with your masks on, so this is really wonderful. And thanks for showing up. This is really going to be a wonderful event. I want to start out by first acknowledging some very special people to us, Clare and Jerry Rotenberg, sitting over here at this table. Not only are Clare and Jerry very special supporters of Jewish Senior Life, they're special friends to me, to my wife, and to many others here in the room. But let me just talk a little bit about Clare and Jerry before we get into really the purpose of today's session, which is the institute that they've founded for us. I don't know how many of you are aware, but Clare and Jerry also have established a scholarship program for our nurse aides to move to LPNs, which provides tuition reimbursement, allows them to, they don't have to work full time, so it's a wonderful program they've done. They also support our very unique physician house calls program. If you're not aware, we have a house calls practice that goes out into the community and provides primary care services to many of the frail individuals in our community. Right now we have about 270 clients on our caseload. They help support that program. They established the Clare and Jerry Palliative Center of Excellence here at Jewish Senior Life, which really sets us apart from many others because of this special palliative care program that we have here in our organization. And just as important, they are diehard Buffalo Bills fans. So let me just talk about, Clare and Jerry just for a second. This event is only happening because of their wonderful gift to Jewish Senior Life. I've already mentioned several other wonderful gifts they've given to our organization. This could be really one of the best that they've done for not only this organization, but quite frankly, I think for our community. You know, just like we are, they're committed to healthy aging, meaningful life, and making a difference in the lives of older adults. The Institute, and I'm going to describe the Institute just for a second, and then I'm going to turn it over to Clare to say a few words. The Institute strives to be the hub of knowledge and innovation to promote all aspects of positive aging for the residents, families, caregivers, older adults in our communities, and many others. I'm very pleased to introduce Clare Rotenberg, founder of the Institute, to say a few words.
Hello, and I'm Clare, and this is Jerry. And this is a very exciting day for us, and we're just thrilled that you all took the time to come here. And thank you, Mike, for your kind words. We've thought about the Institute on Aging for quite some time. And then I noticed that my older friends all were born the same year I was, so I guess I was older. And I said, we have the faces of ageism, so let's go for it. It's very important for us to change the culture. The culture is such that you feel diminished. You feel threatened in many ways. It's changing, but slowly. And each and every one of you are influencers. I can tell by looking at you and the reason you're here, you're going to make a change for us. You're going to make it better for people to become older, to be useful. New York State has one of the oldest groups of older people. It's happening all over the country because we're living longer. And we will be living longer because of all the technology and medical advances. Hopefully, you'll look upon the Institute as your friend. We hope to collaborate with every agency in the city, in the county. Let us help you. Come to us. We want to collaborate. We want to meet you. And again, thank you, and keep in touch. We have a website and a few other things. You can get in touch with us. I know you're going to really enjoy the people that are speaking tonight, this afternoon. And again, thank you for coming.
Before I introduce our guest speaker, just one last thing. For those of you that can stay after our talk and our panel discussion, we have really some very cool and innovative technology just around the corner that we'd like to share with you. Some of it is through our great partners that we have at RIT, and others, some of it is stuff we've just done ourselves. So I'd encourage you to check it out if you have time. With that, I'd like to say we're very lucky to talk about a very important topic, right? How to create age-friendly communities. And we're really pleased that Leanne Rorick, Director of the Monroe County of Aging Alliance, is our guest speaker. And we're really proud that Jewish Senior Life is also a member of this really important alliance. Leanne?
Well, I want to thank you all. I am completely honored to be here to talk with you all about age-friendly communities. I want to preface everything I say, though, by saying this. I am not an expert. No one of us is an expert in this because age-friendly communities require all of us as a community to come together. Age-friendly communities respect the preferences of all of us in this room. And if all of us aren't working together, this age-friendly thing is not going to work. So Clare and Jerry, for your vision of the Institute to focus on successful aging, to give the community a resource, I have to share this with all of you to preface our discussion today. I was having a conversation with our national AARP representative of age-friendly communities, Bill Armbruster, and he commented that this institute is one of the most age-friendly things that a community could possibly do. So again, I want a round of applause. Thank you. So I mentioned that this is going to involve us all. You heard Clare mention that a culture shift is required. It is so disheartening to hear that older adults in our community feel threatened and feel less than. And this is exactly what we want to achieve in an age-friendly community, is the complete opposite of what Clare mentioned to you. I want to mention that when we talk about age-friendly communities, we're talking about all of us. Age-friendly communities aren't age-friendly just for older adults. Age-friendly communities are communities that respect the complete process across the lifespan, from birth to death, that every one of us are aging, our children are aging. If you're 30, you're aging. If you're 50, you're aging. And if you're 95 and still with us, you are still aging. Aging also should respect our own experiences. If I'm 52 and you're 52, we are not the same necessarily because we're both 52. Two 80-year-olds don't necessarily want the same thing, and the same things for how they age, don't have the same preferences. So we need to respect our experiences. It's also important to understand that while physical and cognitive changes might be part of aging, they don't represent aging in itself. So if that's a good start, are we all on the same page with aging? Is that a good level set, I'm thinking? So we're all aging. Raise your hand if you're aging. We're all there. Okay. So the definition of an age-friendly community. The age-friendly community is a livable community, again, for people of all ages. People ask me all the time, hey, Leanne, you're in this age-friendly work. What's the difference between age-friendly and livable? There isn't much difference, and it's kind of confusing. Age-friendly communities are livable for people of all ages. Age-friendly communities represent communities that are for everyone, where age is not a significant barrier to the things that people want to enjoy, where opportunities exist for people to develop all those skills and still want to contribute and participate in life. There's supports and accommodations for people that might need those supports and accommodations, regardless of their age, to access basic services. And decisions and lifestyle choices are respected for everyone of all ages. Age-friendly communities inherently are communities that support people of all ages. Think of it, this is the best example Bill Armbruster actually gave in a speech. I'm going to steal it from him, and I'm sure he won't care. If I walk on Charlotte Beach right now, there's a beautiful wheelchair pad that takes you to the beach. I was there with my friends recently with the Rochester Spinal Association and heard people say that use wheelchairs, of all ages, mind you. This is the first time I've ever been to the beach. That same wheelchair pad allows mothers with walkers and strollers, older adults that use mobility devices, children on scooters and skateboards, although I'm sure Charlotte Beach might not want that all the time. But allows all of us to have access to the beach, no matter what our mobility needs. So I just want to show you to give you a vision. Some people say, okay, Leanne, I still don't understand what is age-friendly. Livable communities are places where all of us, all ages, can go for a walk. Every space is accessible for us, and it's not just about ADA accessibility, but about safety in those spaces. We can all cross the streets, so think safe street concepts, road diets to make sure that traffic isn't too fast, and those ADA compliant situations like curb cuts. People can ride a bike. People of all ages can ride a bike, where bike infrastructure is available with all types of supports, bike boulevards, sharrows. People can work and volunteer. This is work regardless of your age. We hear this all the time. 25% of the people that we surveyed in a recent survey that the Alliance did, over the age of 60, wanted to continue working. 25% wanted to continue working. Almost 40% of our workforce is made up of older adults. And even growing if you look down at numbers like 50 and 55 plus age group. People want to remain working, giving, volunteering, moving, and being involved in community. People of all ages deserve to live safely, comfortably, affordably, get around without a car. This is not Rochester, obviously, but think if this was an RTS on-demand bus, right? Enjoy public spaces. Our county is looking into an inclusive park, which will provide inclusivity for all age groups. That will be hopefully an exciting addition soon. Socialize. Let's break down all of the isolation situations, particularly those that we saw during the COVID pandemic. Access to entertainment. Think of all of the places that you go to be entertained. Are they accessible? Are there enough benches to sit for people that might need a break? To go shopping, and I know this is a lovely picture of two women shopping, but think, are there grocery stores close to me where I can get healthy food? And basically to find the services that they need. That's a challenge in itself right now in our aging network, by no fault of anyone here in this room, or even our systems, but of the complexities of the services that people try to navigate. We all want to live here for the remainder of our lives, here in Monroe County, here where we can access the things that we want and need. So why be age-friendly? People are living longer. They account for a greater percentage of our population. That's no big secret. We need to respect the social, economic, and intellectual capital of the older adult population. Almost one in 4 people here in the county are 60 plus, and that number is going to grow as well. 83% of the U.S. household U.S. household wealth is held by people 50 plus. We talked about jobs, the economic impact. People think that Social Security and people with Social Security are not economic contributors. However, they are. They account for a lot of spending, not just in healthcare, but in other goods and services. And 77 people in the United States, 77% of older adults in the United States want to remain at home. So what's been happening on the age-friendly front, and how have we come to here? The World Health Organization started the Global Network in 2010. This started actually in 1991. That's how far back this work goes. And in 2010, they formed a global network. Nations and states, communities all over the world committing to being age-friendly. 1,439 of them to be exact. AARP picked this up for the US, and by 2012 formed our own network here in the US. By 2017, New York had committed to being the first age-friendly state in New York State. People ask me all the time, so we're already age-friendly? No. This was their commitment. New York State was the first one to commit to being age-friendly. By 2018, Governor Cuomo had signed an executive order to implement health across all policies. Health across all policies focused on 3 different things: the New York State Prevention Agenda, smart growth principles for community planning, and the World Health Organization's 8 domains for age-friendly livability. Health across all policies is important because in all of the work that age-friendly does, if we're focusing on health in every single area for an older adult, successful aging, healthy aging, then we have a healthier New York. The city of Rochester and the county both submitted applications to AARP in 2019 and committed ourselves to becoming age-friendly. We did this with very generous funding. The Monroe County Aging Alliance, of course, was part of that. We'd received funding from the county, from the city, and from the Rochester Area Community Foundation in order to do this work, a lot of in-kind dollars from the United Way. And we've begun the process to achieve an age-friendly community. Governor Hochul recently signed another executive order, a very exciting one for all of us in aging, to create a master plan for aging. And this would mean the creation of a state agency, coordinated efforts to look at aging needs, to expand public and private partnerships in the area, recognize and prioritize older adults, address the birth to death needs for successful aging for everyone. And it calls for age-friendly planning. I also want to bring up, before we move off this slide, I want to bring up a very exciting study that was done in 2021. It was a Perspectives on Aging-Related Preparation. Sylvia Sorensen and friends from the University of Rochester completed this study. People ask all the time, why can't older adults just move faster? Why can't they make decisions before crisis? Why do people in a crisis don't know where to go? What's happening? What's causing this delay? And the study suggested that an effective strategy might be to adopt a community-wide effort to refocus our perspective, to refocus aging-related preparation that people should be engaging in as a way to flourish rather than merely survive. To shift the responsibility from individuals to the community-based responsibility, meaning instead of me being responsible for my successful aging and figuring out how I'm going to do it, all of us in the community are going to be required to come together to figure that out. And this integrated approach, they suggested, should involve state, family, and community. Sounds a lot like the master plan for aging to me. So let's take a look at our own county's plan. Each of you have a copy of the plan in front of you. I'm not going to belabor the plan. It's big, it's thick. There are 29 recommendations and 86 action items and suggestions of how to make our community more age-friendly. It was a community plan that was completed by the Monroe County Aging Alliance and many partners that I want to recognize. Fran Weisberg, who's here with us today. Fran, can you raise your hand? Was one of the consultants on the project initially and helped significantly. Anne Marie Cook and the team from Lifespan were also contractors in this work. In the Monroe County Aging Alliance, we've been together since 2012. We are now, I've got a secret for you. I'll share it with you as long as you promise not to tell anybody else before the press release goes out next week. The Rochester Area Community Foundation and the United Way of Greater Rochester have both embraced the Monroe County Aging Alliance as a shared initiative. So now we belong to both of them, which is exciting. And all of these partners on the screen that you see here are members. Members that said, yes, we want to focus on aging. Yes, we care about aging, but we don't want to sit around and talk about problems. We want to do something about those problems. So that's how the Aging Alliance came together in 2012, really knew that they wanted to focus on this work. And in addition to all of us, there are over 170 community partners that are mentioned in the plan as suggested partners to fulfill this work. Little history on our research. In 2019, we did a gap analysis. We looked at over 22 different strategic plans in the area. Richard Ianello was a consultant on the project for us. He looked at things that we needed to champion. For example, in the Rochester 2034 plan, he looked at gaps in areas that we knew that we needed more focus in our community where nobody else had really thought about focusing, like on respect and inclusion for older adults, for example. The plans were submitted in 2019. In 2020, amidst that pandemic, we did a survey, we completed it, and we heard the preferences of over 1,100 older adults. In 2021, we did a study recognizing the significant, drastic, and devastating effects of poverty on older adults living in the city of Rochester. We knew that we needed that to inform our work. Work groups, focus groups, interviews. And the plan was completed and drafted at the end of 21 and was presented to you in 2022. We also looked at some major trends that we knew needed to affect the suggestions and recommendations that were going to come out in that plan. The fact that 1 in 6 older adults in our community are what is termed elder orphans. I hate that word. It sounds yucky. They are childless older people, but also older people that don't have anyone to care for them or care about them or help them make decisions. Half of the people 55 plus have not saved for retirement. We knew that that would affect the decisions, the recommendations that we made. Older adults today are more likely to hold a college degree, which means they're more likely to stave off retirement for a little while. With greater diversity of our community comes greater racial and ethnic health disparity issues. We knew that that needed to be addressed. And we also knew that there are more health concerns than ever before. People are living longer, but we also have higher obesity issues and mobility-related issues. These are the 9 domains that you will see featured in the plan before you. 8 of them are World Health Organization domains. 1 of them, created by us, economic security, was a direct result of that poverty in later life study. Each of these areas contain recommendations in the plan that's in front of you about how to make our community more livable. I'm going to focus on a couple of highlights today. Again, I'm not going to belabor, but I want to hopefully create some excitement about things that are happening in our community. First, with inclusion, combating aging or ageism is absolutely crucial to the success of all the rest of this plan. If we as a community cannot end discrimination toward older adults, then most of the other things are going to fall on deaf ears. We are watching Governor Hochul, I know, recently voted a state Senate bill to create an Office for Older Adult Workforce Development. It was a little disheartening, but we're hoping that that won't stop. Efforts to continue there. Valuing older adults and particularly respecting older workers is critical. Considering age-friendly business designations is important so that businesses understand the value and the buying power of older adults. And programming and support for deaf and LGBTQ elders among many underserved and underrepresented populations is important. As I mentioned, the very nature of our gathering today is about as age-friendly as it gets. We will also be engaging in a Reframing Aging initiative, both with our members and our partners and the Institute and multiple community partners about how to help the community understand how to frame conversations about older adults, to stop asking someone who's older when they're going to retire, to stop saying, sending over the hill birthday cards to one another. You look good for your age. Dyeing our hair, women, right? There's so many things that we want to dive into and discuss as a community and talk about. A lot of the things that JSL is doing in this area are really, really important to the inclusion of older adults. I particularly like the intergenerational programming here at Jewish Senior Life and the Grand Friends program at Wolk that includes not children. When we think of intergenerational, we think children. Grand Friends program takes 20 and 30-year-olds from Rock City Jews organization and pairs them with the Wolk Manor residents. That to me is perfect. The House Calls program, the Living Well companion care services program, the Sage Care certification, helping to understand LGBTQ elders, a lot in this area. Access to information, we need to reduce the digital divide. Too many older adults, particularly during COVID, were completely outcast from our community, not able to get food, not able to manage things that they needed to manage. And I'm not talking about broadband and putting broadband in communities and giving everybody a computer. What our studies found was that proficiency was what older adults needed and wanted. Computer classes helped to understand their computer, someplace to go, and who to call if they needed help with that. In 2021, we looked at the survey that we had done in 2020. 74% of our respondents said they would go to their doctor for help finding resources. 74%. Most physicians are not equipped, nor are their staffs, to help older adults navigate the complex services that we see in our community. Programs like the House Calls program here at Jewish Senior Life are prepared for that. More physician practices need to be prepared for that. Or we need to find out what we call an integrated service delivery model, where everybody knows who should be called when help is needed, where all of the community partners are working together, where all doctor's office staff know exactly who to call and where to go for the support that they need. Robust mobility management was also one of our suggestions. And we were very grateful to hear that Lifespan recently received a grant to help make our mobility management program here in the county more robust than it already is. So we were very excited about that. Economic security, as I mentioned, that Poverty in Later Life report that we did let us know that there are far too many older adults barely surviving or not surviving at all financially in our community. 1 in 5 older people, 60 and older, in the city of Rochester lives below 100% of the poverty line. And the Elder Index out of UMass shows that there's so much more money than even needed. Even if you're at 100%, you need about $13,000 more per month just for a year to survive. We suggested funding transportation and bill paying programs, infusing financial support in poor neighborhoods, increasing participation in financial assistance programs, and those are just two. I want to mention, too, that the working poor are also affected here. It's not just those living in poverty and not just those that are eligible for public benefits, but the working poor, the people that don't make enough money to be eligible for support, but make too much money to be eligible for support and not enough to survive. On the home and community support side, there are more opportunities for homebound adults. Homebound people are isolated. Many of them want to volunteer. They want to impact their community in some way, and we need to do better at finding ways for them to do it. Again, regardless of their age. Affordable housing and home repair resources. I think we've heard affordable housing on every single plan's recommendation that we've seen in the city and the county. It doesn't necessarily mean that we need, somebody said we can't build our way out of this. It's going to be difficult to build our way out of this, yes. But we need to find alternatives, and we need to find more affordable housing for all of the older adults that are living in poverty, unable to afford their homes anymore, and maybe want to choose more accessible spaces. Safe, walkable, and accessible community spaces is important, and we felt it was important to our community. We heard from older adults, we want more bathrooms, more benches, more safe bicycling and walkable communities, snow removal policies. I know this is on the active transportation plans for both the city and the county, which we are really, really excited to hear. Nobody knows how to solve that yet, but I love that we all realize the problem and are committed to fixing it. Caregivers, for those of you that may have heard Anne Marie Cook's recent presentation to the Rochester Business Journal during the webinar, she cited that 1 in 6 employees right now are caregivers. And 71% of employees report having to cut back on work to provide care for a loved one. That's a situation that we need to support so that older adults in our community have the resources that they need. In this area, I think Jewish Senior Life serves as a wonderful support to those caregivers, helping them to understand the aging issues their older adults are facing, helping them with the technology that might make life easier for them, collaborating with organizations like Lifespan to do things like caregiver simulations and helping people to understand what the caregiver role really means. And a focus on age-friendly healthcare. For those of you not familiar with age-friendly healthcare, some healthcare communities in the area are certified health systems. I'm proud to say that all of ours in the area are, although the journey is different for each. It doesn't mean that every facet of their healthcare system is age-friendly. Age-friendly health systems focus on what matters, what's important to an individual and individualism, mobility, mentation or mood and memory, and medication. But it focuses on a lot more. And I know that Dr. Mendelson and the team here are very passionate about this, and that might be something we want to talk about in our panel in just a moment. We heard from older adults that they want practitioners who take time to give written follow-up, to listen to them, to not push them out of their office. And we'd like to see more of that, more models like the physician house call situation here at Jewish Senior Life. So if you're asking, what can I do to support an age-friendly community? Many of you in this room are in very unique situations and positions. You are influencers, you are impactors, and you are people that have the ability to change some of the things that other people might not have the ability to do. Individuals in our community, no matter their age, are also asking, what can I do? So the first thing that we can all do is reframe our aging conversations. When we talk about older adults, we should talk about them using terms of value. Older people should be discussed with value, yet we stereotype older adults. We use words to show they're frail, need care, are burdensome, even when we don't mean to. Bring normalcy to aging. That's what we all need to do together, is bring normalcy to aging. I'd want you all to remember, if you remember nothing else about age-friendly systems, I want you to remember that it's for people of all ages. Yes, we need to focus on older adults, but this is something all of us are going to have to deal with. All of us are aging. All of us are growing older. The community needs to be accessible for all of us. You could start your own neighborhood caring network if you'd like. We're suggesting this to everyone. It sounds silly, but we need to start kind of back in our roots. Someone would say our old-fashioned roots, the way things used to be 50 years ago, where neighbors took care of neighbors, where people helped one another, where the older adult in one home got the kids off the bus for the younger couple that lives next door, and that younger couple that lives next door helps to carry that garbage tote down the long driveway that the older adult can't manage with a walker. Simple, simple, simple. You can think about your own neighbors to do that. You can also support the age-friendly community in a variety of ways. We accept volunteers. I promise I will find something meaningful for you to do if you want to engage in this work. Those of you in positions of influence, you can advocate for some of the things that you see in that plan. Talk to us, ask questions, gather people together, get involved somehow. If this work seems too big for you, as it seems to all of us, people say to me, this is so big. How in the world are you going to change the world in just a couple of years? My very good friend and colleague, Rosemary Fagan, used to say, if you think you can't make a difference, try sleeping with a mosquito. We can all make a difference. We can all poke until we are heard. It sounds crazy, but thank you all for an opportunity to talk to you about age-friendly communities. Please remember that we're all students, including me, and thank you for your partnership in helping to bring Monroe County to this place of wonderful amazement that we want it to be. Thank you.
Thank you so much, Leanne. You've given us so much to think about. A lot of great work is being done by many people in this room, and there's just a lot more that we have opportunity to do. So thank you so much. I'm going to ask you if you wouldn't mind to step up to the stage. We're going to, but before I do that, actually, I just wanted to make mention that the action plan that's in front of you is compliments of the Clare and Jerry Rotenberg Institute. Please feel free to take that copy with you. We'll now move into our question and answer session. I'm pleased to introduce our panelists who will be joining Leanne on the stage. Dr. Daniel Mendelson, Chief Medical Officer and Vice President, Medical Services at Jewish Senior Life, and Matt Berliner, Physical Therapist and Manager of the Jewish Senior Life Outpatient Rehabilitation. Courtney Poirier, our Director of the Clare and Jerry Rotenberg Institute on Aging, who organized today's event, could not be with us today due to a death in her family. Before taking questions from the audience, I'd like to open with a few questions myself. Starting with you, Matt. Drawing from your work, you ready? Yeah. Drawing from your work as a physical therapist, yes. What do you think we can do better in the Rochester community to be more age-friendly based on what you just heard Leanne speak about?
Yeah, I came up with a couple notes because I had some time to think about this and wanted to be very thorough. As a physical therapist, what I feel like we can do better is this. It's improve health literacy. It's to talk to each other more about what we need to do for a community, for our aging community. And in real time, we're doing this right now, and we have to thank the Rotenbergs for this. So please, one more time, thank you. So we're hitting the ground running. We're starting today. We're doing this. And to help our aging community, we need to be proactively to educate and to communicate more ideas on how to stay healthy and prevent decline in strength and function. Our current healthcare system is based on a reactionary system. We as Americans do not treat or receive healthcare until we already have a problem. Why is this? If we did a better job prophylactically staying healthy, we can do a better job improving our overall health as a society. We need to be more proactive in health literacy, and it plays a vital role in that. There's been multiple studies that show low health literacy has been consistently associated with poor health outcomes and poor use of healthcare services. Low health literacy is consistently associated with more hospitalizations, greater use of emergency care, lower receipt of mammography screening, flu vaccines, poor ability to demonstrate taking medications appropriately, poor ability to interpret labels, health messages, and among elderly persons, poor overall health status and high mortality rates. Health literacy can help us prevent problems, protect our health, and better manage health problems when they arise. And we do need to have better health literacy in many topics in healthcare, but in my opinion, as a physical therapist, it's the importance of performing challenging weight-bearing exercises. Figure that the physical therapist would talk about working out. Yes, I am, okay? Age does not preclude any of us in here from getting stronger, from improving one's muscle-skeletal strength, improving our muscle hypertrophy, adding muscle endurance. As older adults, you can still use the same energy systems as younger adults, and we can all benefit from periodization of strength training, improving muscle strength, function, mobility, and improving overall quality of life and reducing all-cause mortality. We can, just by putting on muscle strength. A recent study from last year, 2021, coming out from Korea, a longitudinal study, they looked at 9,000 people over a 10-year span, and they wanted to look at age-related muscle weakness, sarcopenia, measured by hand grip strength and associated with the risk of both all-cause and premature mortality in adults. Their findings found that age-related muscular weakness was significantly associated with more than 2 times with a higher risk of all-cause mortality in middle-aged and older adults in over a 10-year follow-up period, independent of demographic variables, health-related behaviors, and clinical health conditions. They concluded that preventing weakness of muscle strength has a clinically significant contribution to the reduced risk of mortality and premature death. It's a lot. Sarcopenia does not have to be a foregone conclusion for the aging adult. Again, what's sarcopenia? It's been defined as age-related involuntary loss of skeletal muscle mass and strength. It's mainly the type 2 muscle fibers, the fast twitch muscle fibers, the bulk of all of our muscle. The decline of skeletal muscle tissue with age is one of the most important causes of functional decline and loss of independence in older adults. It has been linked to an increasing risk of chronic disease, physical impairment, cognitive dysfunction, hospitalization, and all-cause mortality. And we know adequate nutrition and challenging weight-bearing resistance exercises remain the gold standard for treatment of sarcopenia, targeting skeletal muscle exercises, the kind that creates muscle repair and regeneration of muscle growth in response to a stress of challenging heavy muscle use. I'm not talking about seated wheelchair exercises, kicking, some bending. I'm talking about standing up, moving, actually challenging ourselves, challenging our muscles to repair, to grow. And as my role as a physical therapist, I strive to educate and teach all my patients weight-bearing resisted strength training here at the Atkins Center. Through our many services with physical therapy, occupational therapy, we have the LSVT program for Parkinson's patients. We have the American Balance Institute certification where I'm trained to work with balance concussion patients, vestibular therapy, and strength and conditioning. So, strength loss doesn't have to be involuntary. We need to continue this effort to educate. We can lower the risk of all-cause and premature mortality in adults by improving our aging community's health literacy and understanding that everyone, regardless of age, can benefit and should be doing challenging weight-bearing exercises.
Thank you, Matt. I appreciate it. Everybody start doing those exercises when we leave. Dr. Mendelson, what's your perspective, on creating this age-friendly community that Leanne's talking about?
Yeah, so I think one of our focuses in terms of contributing to an age-friendly community is contributing to an age-friendly health system. And that's really the 4 M's that Leanne talked about. And for me, one of the ones that matters most is the one that matters most. Why do people come to us for healthcare? It's why they're here why they come to us rather than what's in it for the system. In other words, every adult that enters our healthcare system has some need that they're coming to us to help them with. Most of the time what happens in normal health systems is they just get care. I think what we try to focus on is what is important to that person and really try to do person-centered care. And that's in every program that we have. It's one of the reasons why we have founded the personalized primary care physician program to meet those needs of individuals who really want care that's directed at what's important to them rather than what's important to the insurance company or to the health system. So what matters most? And that's also supported very much by the Clare and Jerry Rotenberg Center for Excellence in Palliative Care. Next, memory and mentation. That we spend a lot of our time here at Jewish Senior Life helping folks with cognitive disabilities get the most out of life. It's part of what we do in the nursing home at the Jewish Home of Rochester, but also at Walk Manor and particularly at the Lodge, where we do a lot of memory care. And it's also a big part of our Physician House Calls program, where we're able to bring really excellent primary care to patients who are at very high risk for ending up hospitalized, and doing the best we can to help those folks age in place and be part of the community that they live in. Certainly, we have a lot of attention to mobility with all the rehab programs we do here at the Jewish Home, and also with what Matt's program does at the Atkins Center. Keeping people moving, I couldn't agree with Matt more. We know that keeping people moving is a big deal in terms of not just their longevity, but the quality of their life. And then finally, medication management. I'm a huge champion for deprescribing. It's not uncommon at all for us to see patients come from the hospital for rehab on 30 medications that haven't been reconciled properly across their time at home with their primary care doctor, their visit to the hospital, their visit to another institution, back to the hospital, and then to us. And my team works really, really hard here to try to make sure that every medication that person is on is meaningful to them. And certainly on our long-term care programs, our primary care program, and our Physician House Calls program, we're really paying attention to making sure people get the right medication at the right time. So we really subscribe to the 4 M's, and I think that's how we contribute most to creating an age-friendly health system, or creating an age-friendly community.
Thank you, Dr. Mendelson. One last question for me, and then we'll open it up. But Leanne, you spoke at a high level about what the state is doing. Can you get a little bit more specific with us? And I know Sarah's here. Maybe, Sarah, you can offer some insights as well.
Sure. I mentioned the older adult workforce development bill that was recently vetoed. We hope that comes back. Senator May also has the Office for Age Friendly bill we hope goes through. That would mean a little more structure. We're doing great here in Monroe County, but there are so many counties that are not, that need more support from the state on this age friendly journey. So I don't know if you want to take. Thanks.
Yeah, the bill that was vetoed, she vetoed a bunch of working group and various bills at the end of just this past week because they weren't done through budget, and there's a cost to them. So we were all sort of promised that the ideas weren't the problem and that we would be working through them in the next session. So hopefully that we are in a good place and just need to do it differently. At the state level, obviously you saw the big announcement, which was the master plan, which I think is really one of the key things that will be a focus even in the legislative side of things to make sure that we're doing it. I serve on the Assembly Aging Committee. It is a committee I fought for. I spent 20 years in the U.S. Senate working for a senator who was on the Senate Aging Committee. I've worked with Ann and Fran and so many people in this room for so long. You know, one of the things that we have learned continually over the years is, first of all, the diversity of our aging population creates so many opportunities, but it also means we have to have a diversity of options, and everybody wants choices. That's the biggest thing when it comes to aging that we continue to hear. So our work has really centered around how do we do that? When you talk about that prescription drug, like when we look at health models that work, we know the connected community, the Community Care Connections program has literally not only transformed the way we think about giving medical care and care for those who are older, it is cheaper and more efficient and better, and people feel listened to and heard. It is that model that instead of continuing to follow up with medical appointments and medical care, is assigning people, case managers, to come in and look at things like prescription drugs, to look at things like, is it a food issue, is it a transportation issue, what are the barriers, let's remove those. It is cheaper, it is better, it is actually have better outcomes, and we do it here, and if we can do it statewide someday, That goes to sort of this master plan of aging and sort of putting all those factors together. We continue to work. As much as we've talked about the opportunities and how people want to age, we know there's still just a huge increase in fraud and abuse. It exacerbates the poverty problem we're seeing in our older generation growing. It is the fastest growing generation that is increasing in poverty, and adding on some of the financial abuse and the scams that I fall for all the time. So we know we need to do a better job of really making sure our population that may be more vulnerable to some of it, when you talk about technical skills and computer skills and the financial literacy, making sure these programs are actually tailored to what people want to learn, not the same ones that a 20-year-old learns, but actually understanding what is needed out of our older population, what they want to learn on a computer, and then, of course, having someone ready to answer questions. Usually it is my 17-year-old son who answers mine and my parents. We need to continue the integration of all these services at the state level to make sure that we're accommodating all the needs and making sure we create those choices. On the housing thing, and I just want to give my example, the example of the beach. We do hear a lot about housing. People want to age at home. We also know we are, first of all, so blessed in upstate New York to have amazing nursing home facilities and long-term care facilities. It is not the case statewide. We are particularly fortunate in Rochester and Monroe County, but we also know that there's struggles, and we need to make sure that we're creating financial models to have the amazing quality continue in places like here and others. But for aging at home, it is increasing housing options. It's looking at ADUs and intergenerational living. How can we do that better? But the home repair has been the number one thing we've heard about. People who are in homes, particularly in Monroe County, it's an older stock of homes. What are we doing to make sure that they can fix their roofs, replace their furnaces, and do those kinds of things? So we passed also to not even just think of things that need to be fixed, but you think of climate change and alternative energy sources. We just passed a geothermal tax credit to help people move to geothermal, which would reduce utility bills, cleaner air, all these great things, helps us on our climate goals. But it's through a tax credit, and most seniors don't have a tax liability. So we've created a program and really sort of set out a group that isn't even going to benefit from it. So we're not giving them the opportunity to use it. So why we need to keep all these things in mind when we're creating any policy, why these kinds of conversations are so important. So thank you for inviting me and letting me be here. And I look forward to more discussions and always happy to answer questions. So.
Thank you, Sarah. I want to thank you all for coming, and a special thank you to Clare and Jerry for making today's symposium possible.